It's nice and soaked. Still, it causes a little bit of pain. No, that's fine. It's almost out. Alright, so. You what do I actually? 7 weeks, 7 days, right? Can you go and remove this also? Sorry, I'm just cleaning off the slight blood clots on the side. So remember, you had a lot of double chin. Yeah, all of that is gone forever, gone for good. And we've also done a lot of things on the nose and rib harvest, right?
Yeah.
Okay, I'm going to take this off now, and then you can have a look. Alright. Yeah, you can have a look now. So. You can keep your mouth closed, but then you get the right proportions when you bite your teeth.
Is this still swelling there?
There is swelling, obviously. Just 7 days off, right? There's still a lot of swelling, but you can see the proportional change in the shape of your nose. You see that? That was like broad, and we reduced it a lot. But you know, for your face, this will suit good. It will be really nice. You shouldn't make it any smaller. First thing. And the next thing is look at the grooves. It's going to come down significantly. So all this is going to be tighter. That's going to give you a youthful look. Next, around the eyes. So because we've augmented here, these areas around the eyes also, that grooves will be less. These grooves will be less. Okay. Then moving on to the chin. So chin, you can see now how it's like looking really strong and manly. We're going to show you the side views also. Look at that.
One of the concerns with chin is that it looks kind of broad now. But
Yes.
stay broad.
It will take 3-4 months. You will feel perfectly fine. All that will become alright. Plus, this is the muscle that goes around, okay? It's called the orbicularis oris. I've pulled it from down and here I've squeezed it there. Same muscle has been attacked in different ways. So there will be
So what is
tightness.
the reason, primary reason for doing that?
So because you wanted to get rid of the double chin, we're giving you a manly chin. We're also taking the proportion of your nose to make it. One more thing, you can look at the nose. I'll just show you this also. Look side. So here, if you see, look at the length of your nose. It was really short. Then this angulation, not very nice. We can sit straight in, have a peep into your nostrils, but now it's not going to be like that. So the projection is better. This angulation is more precise. This width is less. This height is more continuously. There's a nice straight dorsum. Yeah,
So this is going to slim down in some way?
this like marginally. There's going to be more slimming down here than here for you.
Because I feel somewhere it's like a single size.
Single size.
It's like kind of straight. It's not like a. I would have rather seen it more defined, like it's coming like that and then.
It's the shape of the nose.
Yeah.
See, because
Just have to,
because see what happens is, I'll tell you, I'll show you this.
would just remain the same this part.
Yeah, now if you look here, now you see that
Yeah.
there is a, if you look here, so there's so much of work that needs to be done in order to change that proportion to this. Your nose was broader than the tall.
Yeah.
So that is why, we have limitations. I can take a patient up 1 or 2 rungs on the aesthetics of nasal beauty. We can't just create absolutely gorgeous nose or something that's down in the dumps, you know. So what I'm trying to say is the improvement. So what you're saying is a point, but that is possible if you come to me this kind of a nose already.
Because I don't have that.
That will come back. Sure, it will come back. Oh yeah, 100% will come back. It's not going to be as pronounced as it was earlier.
Because you see that usual that.
It will come back.
Yeah.
No, see, the soft tissue will mold in here. And you will get the groove back. This groove also is a little bit more than now. But what will not change is the width and the height. It's pretty much going to be in this proportion.
Good.
Okay. You're just worried about the groove. That will come back.
The thickness here. I wanted it to be like more like it just slopes down.
Okay.
I feel like it's not sloping.
Not sloping down so much, yeah, maybe.
Here.
The side. It looks more straight.
Yeah, it's sloping down pretty okay on this side. But here,
not as much. I think it will settle down because of the surgery and the augmentation. It's going to settle down. It's going to be good. Alright? So we'll take off the stitches.
So, what would be my recovery time?
1 month minimum. Not anything before that. Considering your age and considering the amount of surgeries that we've done and the movements that we've done. Definitely 1 month, give it good rest, good proper healing. Don't sleep on the left, don't sleep on the right, don't go for contact sports, have dietary restrictions, and take our tablets.
So, when do you think I could even start any exercises or anything?
November?
So, that's a good 2 months.
No, a month and 2 weeks.
Yeah.
Not even a month and 2 weeks, a month and a week.
Okay.
Yeah, give it a little longer time because, see, also the age factor, right? You're not like in your second decade.
But I'm usually working on it. That's the reason. The reason why I'm asking is I paid my trainer for work. So he's gonna just take the money and go. But I asked him to on a serious note. But when can I get back to at least like a regular
November, I
exercise?
think. Don't do it before that because see, we've done extensive work for you. Rib harvest, osteotomies, extended osteotomy tattoo.
So how is it going to impact? Or like if any,
Because
on a regular exercise.
you want the bone not to move till it heals. And you lift weights, you stretch, you clench, you just start to get more activity of the muscles. So no.
So how long do this?
Everything 4 weeks.
It's going to take 4 weeks.
This is going to heal fastest for you.
Okay.
This is going to take more time. Because that's the place we were harvested and it's the place we put in. It's going to take more time in the recipient area.
And this is going to stay long as
It will get a little bit, imagine this shrinking all around by 5 millimeters, 20%. But you still have a nice strong jaw now. Nobody ever will be able to see your double chin. That's going to be taken care of forever. But the chin will be little broad.
eating, I kind of realized
No, that will take a
eating was
while.
like,
I'm already
if
now.
I was holding a bowl and then trying to eat, this was kind of,
So that you give it another 1 week, it'll be fine.
it was coming in
Also, there will be some numbness here now. Is it totally?
little
Numbness.
quite.
See?
So I feel like this
That's
is like a
right.
swelling.
All of that will settle down.
And with the sutures part, if I
No need to
do,
remove anything.
so wherever the sutures are, now, of course, I'm quite, clean as far as my habits of dental hygiene is concerned. I brush twice a day, but I haven't been doing so yet. So when can I actually,
You can start brushing, no problem with that.
but then sutures,
Nothing, no issues.
will they not hurt? Okay.
No, it will not take nothing.
And
In fact, you should brush quite regularly and keep it clean because if your intraoral hygiene is not clean, it can lead to some infection.
yeah, so can I do the opening of my mouth?
Yeah, sure.
And then
Yeah.
try to,
Do gently. Just go slow on everything. Don't pick on your nose, don't touch your nose, don't move your chin, don't rust your chin. All these precautions. Avoid handling that entire area for a month and a week or a little longer than a month.
okay. So brushing is
Brushing is good. You need to
and
brush.
with the eating thing. So I've been on liquid diet for almost 6 days.
So slowly get the soft solid, and then after a couple of more weeks, you can get back to almost normal diet.
So, what would you recommend?
Let's say from October onwards is fine. Till that time, idli type soft food is alright from maybe tomorrow or the after.
Something that I should not chew.
Yes.
But
If you
anything
chew a lot,
soft
the
food.
muscles will be active, healing can get a little bit hampered and all of that. And you know, see another thing is you're all traveling back, you're going to Bangalore, I know I can easily troubleshoot, but still, I rather be on the safer side than otherwise a little bit sorry so as to why take that chance.
So, what would you recommend?
Not to try anything different for a while. Continue the same liquid semi-solid for a week more at least.
For another week?
Yes.
No, I don't intend to like start eating really
And
solid.
chapatis and something very chewable you can postpone by even 2-3 weeks.
No, I can stick to soft food. Right? Dosa.
Little chewing is required for that, yeah.
So idli and pongal.
Yeah, that's fine for starting. If you start after a few days, then continue with that for 1 more week. But still have a lot of fluids that can go on.
But it's just that I find it very difficult not to have any of the cold drinks. Warm, I'm able to take it. Cold, because of the throat issue,
Yeah,
my bronchus is quite weak.
correct. Also see, when it's a long surgery, anesthesia is long, tube is inside for long.
So it's kind of blues really
all
bad.
all that, yeah.
So
Takes a
I
while.
realized that I can take a warm drink but not a cold drink. So probably can I
That's
stick
okay.
to some hot milk
Stick with
and
Stick for some more days, not a problem.
and
Are
what
you
about
leaving today or tomorrow?
alternate? Say about that.
All the medicines, everything, take them correctly. We'll give you
Anything that
another-
I should keep in mind in
All those things that I told you to keep in mind. Every single thing.
Yeah.
Not anything, everything. And also, we give you a number in case of any issues, you will contact us on that. Take good care. Okay?
My only concern is right now the nasal passage, the pain that I have. So that's kind of like obstructing.
It will take a while. It will take a while. You know, see, just the nose itself is a very major procedure for you. Then we've done the chin, and almost like an extended osteotomy, considering your age, later half of the 4th decade. All these things add time for healing. That's why, you know, that's why I want to be careful. That's why I'm saying even normally 4 weeks, I say, okay, in the mouth. Then we give you ointment here for the next few days. After that, one more ointment we give you, that here, nothing else in the mouth.
So the gel needs to go onto the vest.
Yeah, the doctor will show you how it's to be done. Preferably apply gel before you have food.
Okay.
And don't wear specs for a while.
Oh,
Don't
that is the
do
biggest
anything.
problem. I forgot about. I have to wear specs to work.
You don't have contacts.
No.
So we'll see if we have some shit.
Because I get really strained if I have to.
Take rest.
And even for reading, I need that class.
No, but it'll affect it if you wear it very soon. Bone takes minimum 4 weeks to heal.
Can I do like breaks? Keep it sometimes. But I don't keep it on for all the time. It's only during the work.
I try and give you a splint that you can put it on top,
Right.
but I still will recommend you not to because of the rib grafting that we've done.
Yeah.
What happens is in some patients the rib graft takes a while for it to set. You keep wearing specs, you can get a small depression there.
Okay.
Bone will be around that because of constant pressure. Same with mouth mask. Do not put the elastic masks. Tie the mask around. I'll give you some masks like that.
Just that my reading,
We'll
working
try
is
to
going to
give
get
you a
worse.
we'll try to give you a splint for that for the time being. Okay.
Yeah, that will be great.
Take
Thank you.
care. Welcome.